And let's bring in ABC News contributor Dr. Alok Patel for more on this. Dr. Patel, thanks for being here. As we just heard, COVID cases are on the rise worldwide. This new version of the Omicron variant, BA.2, is likely responsible for this spike. So what do we know about this variant and how concerned should we be?
Well, Diane, I don't know if I would jump to saying that we should be concerned as an entire country, because we're in a much better place than we were last year with respect to the level of natural immunity, vaccine-acquired immunity, and treatments such as antivirals. But here's almost the trifecta that has us watching what's happening in Western Europe and in Asia, is the fact that you have this subvariant of Omicron, which, as we just heard, is more transmissible, possibly able to evade some of our some types of our treatments. You also have waning immunity, which is shown to actually drop down maybe 75–85% protective against hospitalizations after 5–6 months. That's after a third booster, and the fact that we're lifting restrictions across the country. So that is a setup, at least for individuals who are 65 and up and those who have weakened immune systems, to be at a little bit more increased risk. And that's why we're seeing the discussion about a fourth shot and also possibly reinstating masks, which is not going to be popular, but might be necessary.
Now, states across the country just eased their COVID-19 restrictions, including lifting vaccine and mask mandates. So do you think it was too soon to make that move? Do you think we're going to be headed back there again?
You know, I side with a lot of my colleagues in saying that it may have been too soon to flip the switch on the mask recommendations. You know, Diane, we essentially went in 1 week saying that about 90% of the country was high risk to flipping a switch and creating a new metric and saying 71% of the country or more was in a situation where they could lift masks. Now, it's possible that we could have done a little bit more of a layered reduction here, but we are where we are currently. What I hope that people understand, though, is that masks may have to come back on. We may not have to close down. I shouldn't even say may. I don't think that's going to happen because we're in a much better place. But people should be prepared, and we should be prepared to do what we can to protect those 9 or 10 million immunocompromised Americans and the millions of Americans above 65, which about a third have still not yet gotten a third shot or a booster.
Now, Moderna is requesting FDA authorization for a second booster shot for all adults, while Pfizer's request from early this week was just for people over 65. So what do you think about these requests? Do we really need another shot?
You know, Moderna is getting bold here. I saw the request was spanning a very broad population, and I understand the sense of wanting to give healthcare professionals the flexibility on whom to prescribe, whom to advise to go get a fourth shot to, but there doesn't seem to be any data, concrete data, saying that young, healthy individuals should go out right now and get a fourth shot. There definitely is data supporting that people above the age of 65 or those who are immunocompromised need to as well. We're just going to have to wait and see what actually happens when the advisory committees sit down and make their final recommendations, probably in April. But I do see an approval from Pfizer going through, at least in those individuals above the age of 65, which is what we're already seeing in other parts of the world.
Now, more than 30 companies worldwide have now agreed to start making the generic version of Pfizer's COVID pill, and it's been found to cut the risk of hospitalization or death in high-risk adults by up to 90%. So this move would make the pill available to more than half of the world's population. What kind of an impact could that have, and could that change how we approach COVID, sort of focusing on treatment and maybe having to focus less on prevention?
Well, theoretically, this can make a huge impact, and this is actually a great move by the Medicines Patent Pool, which is actually an instrumental organization for making sure that we're getting treatments out to lower middle income countries. They've done the same with respect to lifting these patents for HIV treatments, hepatitis C, tuberculosis. But, you know, there's two questions that arise right now. Even though that 95 countries may have access to a generic version of Paxlovid, still about 50% of the world will not have that. And then also there's a question of how quickly we'll be able to get this generic version to those in need. For example, one country that was actually offered the license was Ukraine, but right now, because of the conflict, they're not actually able to sign that and produce that. So if BA.2 is doubling, just as we heard from the CDC say, every few weeks, is that going to be fast enough to be able to get Paxlovid to those out there who need it, who don't have the hospital capacity and don't have an antiviral? So long story short, I think all efforts still need to be on the table right now. But it's a great move forward.
All right. Dr. Patel, we appreciate it as always. Thank you.
Appreciate you, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.